A very good afternoon to all of you. Welcome to my YouTube channel, Pharma Inspire. So, till now we have discussed about angina. We have discussed about the various types of angina, stable angina, unstable angina. So, in this video, we are going to talk about the third types of drugs which are used in the treatment of angina. This third type of drugs are calcium channel blockers. These are the drugs which are used, which are the third preference of a choice for the treatment of anginal pain. Now let's talk about how these drugs actually work. What is the mechanism of action of these drugs? Okay, so calcium channel blockers are those category of drugs which ultimately inhibit the entry of calcium into the body मसल्स एंड द वेरियस ब्लड वेसल्स के सेल्स में कैल्शियम की जो इनफिल्ट्रेशन होती है उसको स्टॉप कर देते हैं. वी नो दैट फॉर द कंट्रैक्शन ऑफ ब्लड मसल्स वी रिक्वायर द कैल्शियम पॉजिटिव. फॉर द कंट्रैक्शन ऑफ blood vessels we require the calcium positive. So ultimately if this both thing does not get the calcium, they're not able to contract. So this is how the calcium channel blockers work. They inhibit the entry of calcium, due to which the body muscles and the blood vessels does not get the enough amount of calcium for their contraction, and due to which their contraction inhibited. Okay, so अगर उनकी contraction inhibit हो जाएगी, so ultimately the beating speed of heart is also get stopped. This is what happen in sometimes anginal patient. The contraction get very faster. So this is how by decreasing the speed of the contraction, these calcium channel blockers work. Okay, so other than the angina, they are not only used in the angina, they are also used in the hypertension treatment, and they are the first line anti-hypertensive drug. I think the pharmacy student and the other medical student knows about the first line drugs. These are the drug. कोई भी अगर किसी भी तरह की disease से आप सफर कर रहे हैं, so first थिंग्स और फर्स्ट कैटेगरी ऑफ ड्रग्स जो डॉक्टर प्रेफर करता है उसको हम बोलते हैं फर्स्ट लाइन ड्रग्स. Okay, so these are the calcium channel blockers drug. Okay, talking about, they also can induce, not only they are also used in the treatment of migraine pain. So they can be used in the three medical condition I have talked about. Hypertension, they can be used in the angina, or they can also be used in the migraine pain. Okay, and two, they are related with the certain side effects in the patient. So side effects which can be related with this is dizziness हो सकता है, postural hypotension kind of a side effects. पर्सन बीपी काफी लोअर हो सकता है इसकी वजह से. हम हाइपरटेंशन के ट्रीटमेंट के लिए तो दे रहे हैं, बट इसका साइड इफेक्ट भी हो सकता है कि पर्सन का बीपी एक्चुअल में काफी लो हो जाए. सो डिजीनेस हो सकती है, फैटीगनेस, दैट इज वन ऑफ द साइड इफेक्ट which can happens in the patient. And one of the side effect can also occur is edema, that is swelling in the body arms and the swelling in the legs. That can also be the one of the side effects that can happen because of these drugs. So one of the other two side effects which can be happen is the palpitations and the reflex tachycardia. Reflex and palpitation का मतलब क्या होता है? This is the kind of a sensation in which you have the feeling that your heart is beating so faster and so harder. So that is a palpitations. So this is kind of a thing which can happen with the administration of calcium channel blockers. Now what is reflex tachycardia? I think you know about the tachycardia. Tachycardia is the condition in which heart beating is very faster. Okay, bradycardia जिसमें heart beat काफी slow होती है. Now what is the meaning of reflex tachycardia? No, as calcium channel blockers, they decreases the speed of beating of the heart. वो heart की beating को काफी कम कर देते हैं, जिसकी वजह से body tries to increase that heartbeat, and that's why that is known as a reflex tachycardia, in which body's own mechanism causes the beating of the heart very faster. So reflex tachycardia, palpitation, edema, dizziness, fatigueness, and the lower BP. This is the kind of the side effects which can happen to the patient after the administration of calcium channel blockers. So by this we have covered the anginal disease. We have discussed that this is the disease which happens due to the imbalance between the demand of oxygen and the supply of oxygen. We have discussed that there are three types of angina: stable angina, unstable angina, paresmental or variant type of angina. Okay, after that we have discussed that unstable angina is a quite severe as comparison to the stable angina. Okay, after that we have discussed the three categories of a drug which can be used in the patient: nitrates, which are vasodilators, which complete that supply, which increase in the anginal patient. Second, we talk about the beta blockers, which decrease the demand. Okay, third we talk about the calcium channel blockers, which work by stopping the excessive contractions of a blood vessels. Okay, so I think you are clear with my complete explanation about the angina disease. If even that you have any doubt related to this disease, that how this drug work and what is the mechanism of action of this kind of a drug, you can ask me in the comment link. I will try to answer you in the best way possible. Okay, thank you so much. So we will meet in the next video with a discussion about the new disease. Thank you so much.